I'm Bridget. I have my master's degree in mental health counseling. I got that in 2009, and ever since after I graduated, I came to Forest. And so I'm in my 4th year here. I'll be leaving in July to go to Seattle for my pre-doctoral internship, which is the last step into getting my PsyD. I'm doing, I guess I did my concentration in primary care psychology. So I'm very interested in kind of the link between the medical field and the psychological field and the mind-body interaction. So I gave a presentation a few weeks ago on procrastination and anxiety. So a lot of the same, I guess, points that I made then are going to kind of come more into the realm for panic and understanding panic. But there's going to be some similar underlying themes that you'll see as we go along. My partner, David Bauman, he helped me make this presentation. So understanding panic, and then hopefully the second part is the important part as well, is ways to get through it. So I felt like a large part, a lot of times with panic, and understanding where it comes from, why we experience this. Because if not, you're kind of going into it dark, and you're not really sure what you're up against, so to speak. So the objectives of today is we're going to learn some common symptoms of panic. We're going to learn the definition of a panic attack. We're going to learn the definition of panic disorder. We're going to learn why the body reacts the way it does, and what this means for people on a daily basis. As well as these are the 3 exercises that will help with the coping aspect of the panic. Gain knowledge of an acceptance/willingness exercise, knowledge of a mindfulness exercise, and cognitive diffusion exercise. So those will make more sense as we move along. Okay, so a lot of times in everyday life, turn on the TV and there's some reality show and someone's talking about a panic attack. Oh, I had this panic attack, and I had this panic attack. My panic attack lasted 2 weeks, or this, and this. And it's kind of hard for us to know, well, what actually is a panic attack? What is panic in general? So hopefully, as we go through this, you guys will leave here kind of with a lot more sounder idea about what actually is panic, what's a panic attack, and then what's panic disorder. So what do you guys think, just off the top of your head, when you think about panic? What type of symptoms, what happens in the mind and the body when somebody's panicking? Pounding, racing heart palpitations. This is a big one that gets people to the ER. If they have no history of any type of heart disease or heart conditions, and they've been cleared 2 months ago by the ER, a lot of times these symptoms are so intense that it'll keep them coming back to the ER. Even though, 2 months ago you were cleared, you're good to go, but it'll keep them coming back because the symptoms are so real. So actually the heart palpitations, the chest pain discomfort, they're having a heart attack. And again, if you've just been cleared 2 months ago, you probably haven't developed a heart attack in that amount of time. Trembling, shaking. I'm actually not shaking today. Sometimes during presentations you see your hand going, so obviously not panicking right now, which is good for you all. Shortness of breath, sensation of being smothered. You just feel like you can't breathe. Sweating, feeling of choking. That's could be a really scary one. Like I can't breathe. It feels like I'm literally choking on my own air or my own saliva. Nausea, abdominal distress, just really dizzy, unsteady. This symptom also tends to freak people out a lot. Most of us know when we're feeling a little shaky, or most of us know when we're maybe sweating a little bit. But when you start getting really lightheaded or unsteady, you start feeling, okay, maybe I have a brain tumor, or maybe there's something seriously wrong. But these can be symptoms of panic. Derealization. These are very unpleasant for anyone who's experienced these. Feelings of unreality. It feels like the kind of like maybe a person is in a video game, like things just aren't real. And then on the same token, the depersonalization. So that's when you're kind of detached from yourself. It's kind of like you're looking in on yourself. And you could have numbness or tingling in your face, your hands, your legs. It just feels like kind of an out-of-body experience. Fear of dying. Am I going to die from this? Am I going to not be able to breathe? Am I going to choke? Chills or hot flashes, or being hot, having your face totally flushed. Fear of losing control or going crazy. This also brings people into the ER. A lot of times you feel like I'm going to lose my mind. I'm going to lose it. And I'm going to be careful when I say this. If you're at the point where you're panicking and you're feeling as though you're going to lose your mind and you're aware of that, most of the time you're probably not going to lose it. And as I said before, a lot of my background is on medical conditions and the relationship it has with psychological conditions. So we have two sides here. The first is medical conditions can cause symptoms of panic. These include the cardiopulmonary disease, so that is heart disease, and asthma. If you have asthma and you can't breathe, it can mimic the signs of panic. Alcohol withdrawal, caffeine overuse, stimulants, other drugs, post-concussion syndrome, any of these things can cause panic-like symptoms to where you might not have necessarily a psychological disorder, you have a medical condition. So if that's the case, again, if these are prolonged and over a long period of time, it's really important that you meet with your doctor and rule some of these things out. Because how are we going to know if it's psychological or medical until you kind of get cleared? And then on the reverse side of that is your psychological condition often affects your medical conditions, and it can exacerbate it. It can make it worse. So people with ulcers or ulcerative colitis, hives, hypoglycemia, asthma, cardiovascular disease, hyperthyroidism, some seizure disorders, having the panic attacks, the psychological issues can worsen your medical disorder. So it's very important that you kind of get a handle and figure out, a lot of times it's such an interaction between one cause and the other one, it is hard to decipher. But it's very important to rule out any major medical conditions. And then once you do that, then you can really start focusing on ways to cope with some of these issues. All right. So again, if you have a panic attack, does that mean that you have panic disorder? It really only becomes a disorder, according to the American Psychological Association, when you're having a discrete period of intense fear or discomfort, which reaches its peak within 10 minutes. So the exact time on panic attacks is not nailed down. It's not, okay, it's going to be exactly 60 seconds. Normally, it builds up. You have all the symptoms that we talked about before, the heart rate, and you can't breathe, and the fear of losing control, and it keeps kind of worsening. And it hits that peak right about 10 minutes-ish. It's not exactly 10 minutes. And then from there, some of the symptoms can kind of remain. It might even remain up to about an hour. But normally, again, you're reaching that peak, the worst of it, about 10 minutes. So you have to have 4 of the symptoms of one of these, or 4 of these symptoms.
4 of the ones in red?
Both. I just did the red and black just so you can see it better. So it can be pounding, racing heart, chest, trembling, shortness of breath. If you have 4 of these, that's the criteria that you need.
Oh, shit.
Yeah. Now, some people have all, however many there are here, they have all. And then sometimes people have partial panic. Maybe they'll only have 2 of these. So, at a given time. But they might have the 4 symptoms at other points in time. So they also have to be recurrent, so it can't just be a one-time thing. It's got to be, now the DSM doesn't say specifically what exactly constitutes recurrent, so it definitely is more than one. It's got to be a couple, and sometimes they could be weeks apart. They could be a week apart. They might only be a day apart. So this varies a little bit, unexpected. So a lot of times we get really panicky when we're driving in the car and somebody pulls out in front of us. Your heart starts racing and you're in panic. But that kind of matched the situation. Car would pull out in front of you, you almost possibly were injured or killed. So it makes sense. These, when you're actually having the panic disorder, they're coming out, they're unexpected. You could just be walking through the mall. Oh, an issue. Sitting in class, not doing much. Sitting at home, watching a TV show, listening to the radio. It could be anything. And they're unexpected and they come on. And then the last criteria that you need is it's an attack, a panic attack followed by at least 1 month of one of these. So you go, you had your unexpected third, fourth panic attack, and then for the next month, you have a persistent concern about having additional panic attacks. You're like, oh, am I going to have another one? That last one came out of the blue. When am I? It's going to be today. And then it's also worrying about the consequences. So if you do start having a panic attack, am I going to have an asthma attack and not be able to breathe and pass out? Am I going to go crazy? Or it could be even that you're worried that it's going to be embarrassing. You know, you're really just worried about the consequences of this panic attack and what it's going to mean for your life. And then the last one is significant behavior change related to panic attacks. So a lot of times this has to do with you're not going to go to a certain place anymore. You're going to avoid it because last time that's where I had the panic attack. So now I'm not going to go there again. And a little bit more on this. This isn't just necessarily about the embarrassment. I just want to clarify that you actually are worried that you might like vomit, that you might go crazy, that you might get committed, you might lose your job in addition to that embarrassment. So when you worry about the consequences, you sometimes actually might be worried that you're going to die or throw up or something, in addition to you might also be worried about being embarrassed. Because what if I have this panic attack in class and everyone sees me? What are they going to think? So it's both for that number 2 there. And again, it can't be due to substance use or medical problem. That kind of makes sense. And then, for this presentation, I really want to focus on what some of the symptoms are and then what we can do about it. A really exhaustive list of the diagnoses at this point for this presentation isn't necessarily needed per se. If you think that either you or somebody else around you has these intensive symptoms, I would definitely recommend getting in and talking to a mental health professional. So we're going to kind of move on. I just did want to let you know that there is with and without agoraphobia as far as it's panic disorder with or without agoraphobia. And this is really an emphasis on being scared about being in places where you can't escape, where you can't get out. It's going to be embarrassing, or you're going to be you're scared about being home alone, or you're going to be scared of being in a crowd or being in line, in a crowded line or something of that nature. So we're not going to focus too much on that. I just want to let you know that there are 2 types. There's with and without agoraphobia, and like I said, agoraphobia is when you really want to make sure that you can escape a situation. And anytime you're home alone, you want somebody else there, or you want some type of exit in case you're in like a confined place, like an escalator, an elevator. It could be an escalator if it's a busy one. All right, so we're going to kind of go back more to the panic attacks. And again, if you think that you or somebody that you know has panic disorder, definitely getting them in to see a mental health professional is highly recommended. So back to the panic attacks, it's, as you mentioned before, Becky, you said about that people want to leave or escape the situation. Definitely. It's this, the person's there, and it's this overwhelming fear that creeps up. And it's like, I got to get out of here. I have to get out of here now. And because if not, I'm either going to die, I'm going to lose control, I'm going to stop breathing, or I'm going to humiliate myself. One of these, or it could be a mixture of them. And the other thing I want to mention was this sense of impending doom. It's kind of hard to understand sense of impending doom unless you're really in that panic moment. But for those who have panic attacks, it literally feels like this is it. There's just this apprehension, and it feels like there really is going to be doom, so to speak. It's not funny. It's actually quite terrifying for individuals who experience these symptoms. Think about your ability to think when your life is in danger. Do you have time to like sit and reason through and think about things rationally? You know, basically your frontal lobe part of your brain that allows you to think about things rationally, that pretty much gets shut off. Because back, however when, and we're in the savannah and there's a lion that's attacking us, you don't have time to say, okay, so the lion weighs a few hundred pounds and I weigh a few hundred pounds, you know, give or take. This thing is 3 times my size. It's going to kill. I don't know how big a lion is, so this is a bad example. But you don't have time to be measuring it up, and you're measuring yourself up and comparing and contrasting and thinking rationally. No, you see a lion, you either kill it with your spear or you get the heck out of the way. Run up a tree, do anything, get safe. You do not have time. It is ultra focused, and could you imagine if the lion was coming at you and you had somebody right here saying, like, you know, just be calm right now. Like, just try and deep breathe with me. You're like, there's a lion, there's a lion right there. What are you talking about? Well, no, just think calm, soothing thoughts. I mean, doesn't that sound ridiculous? But that's actually what our mind is doing. It's doing something very similar to if there was literally a lion or a tiger or a car coming right at you. So that's why in those moments our brain is not able to hear these really nice suggestions by these well-meaning people. The other reaction that I wanted to talk about a little bit was the avoidance. Well, if I'm going to have panic attacks, I'm just not going to go work anymore. I'm not going to spend any time with friends anymore, because last time I did, it was humiliating. I'm not going to go to Walmart anymore. I'm not going to leave my house. See what else they have on here. If you do go to movies or restaurants, you got to sit right near the exit. You got to walk in, you know, find the exit, locate that, and then you have to be in a position like at a restaurant. You have to be the closest one to the exit because you can't be on the opposite side. So now we're doing a lot of mental effort and a lot of mental energy to prevent possibly a panic attack. And how engaged are you with your friends? When you walk into a restaurant, instead of looking at the menu what you're going to eat, you're scouting out the exits. So then you go home and you feel bad about that and you say, well, I didn't really have any fun with my friends because I was worried about finding the exits the entire time. Next time I'm just not going to go. I'm not going to go work. I'm not going to go to Walmart. I'm not going to go to out to eat with my friends, and your world shrinks. And then a lot of times symptoms of depression come out. Well, in a world that's so restricted, how is that person going to feel good about things? If you were totally confined to one area, how are you going to feel good about life? So that's kind of the thing that is troublesome about panic attacks, is they are so frightening and they are so uncomfortable that people will do almost anything. And that means cutting off large parts of their personal life that they enjoy in order to not have them. Yeah, with panic disorder, a lot of times they try and find a disorder that was more of the primary cause. So in the case of PTSD, a person might have PTSD and symptoms that match panic disorder, but the PTSD is kind of what came first and kind of subsumes and counts for the panic. So people with PTSD, they have that hypervigilance that I was just talking about, of scouting out the exit signs. They have an unusually intense response to regular life events because their brains had the trauma of a situation in which there was a really intense moment, a really traumatic thing happened to where benign, everyday, mundane life triggers that. So a person definitely can have, who has PTSD, this is seen a lot of times, and they kind of go hand in hand. And in fact, you made another really good point. The approach that I'm talking about, the acceptance and commitment therapy, is the behavioral therapy standpoint from which I'm doing all these presentations from. And whether or not you have anxiety, PTSD, panic disorder, depression, any of these things have the underlying issue of avoidance. You're trying, when you're depressed, you try and avoid. When you're anxious, you avoid. Panic attacks, you got to escape. You got to avoid that situation. So it's kind of across the diagnoses, there's a lot of really, really, really similar themes. And one of those themes is avoidance. And the more people avoid, the less they're living the life that they originally wanted to live. You have all these things that are important to you: work, family, friends. But at some point, you can no longer engage in those things because you're spending all your time feeding the avoidance, which is exactly the next slide. Is imagine your anxiety or your depression or your panic, whatever it is, the uncomfortable, I'm going to call them teams. T for thoughts, E for emotions, A for associations, M for memories, and S for sensations. So all the things that happen in your mind that are uncomfortable and unpleasant and you don't want to have happen. And a lot of times those uncomfortable thoughts do lead to physiological as well, shortness of breath and sweating. So imagine that those teams, those uncomfortable feelings, are a little baby tiger cub. Look how cute it is, right? It's so cute. And it's, again, your anxiety or your depression or your panic is the tiger. And it's so cute. And you got to feed it, right? You got to feed your tiger because you're going to want it to grow up. We'll pretend we're working in the zoo, but this makes more sense. So you're working in a zoo and you got to feed it. So you feed it a little bit of avoidance. You're like, well, I'm just going to I don't really want to talk to my sister today. She kind of bothers me, so you feed it a little bit of avoidance. And you feel better, and the tiger feels better. All right, great. And then you keep doing this, and then a couple weeks, it's saying, I'm hungry, but now you can't just feed it not answering your sister's phone call. Now your friends are calling and they want to hang out. So now you got to feed the tiger more of your avoidance. So now you're not calling your friends back. And then the thought of going to that grocery store with all those people there and all those crazy drivers on the road, you don't know if they're going to hit you. And I'm not trying to die today, so I'm just not going to go. So you feed your tiger even more avoidance, and it keeps growing and growing. And what turned out to be something that was not so harmful, it was cute, it was fine, everything was good with it, has now become this gigantic tiger that controls your life and says, feed me, feed me, feed me constantly. Feed me avoidance. Because I don't want to deal with it, and it stinks. I'm on camera, so I'll say stinks. It stinks to have, these feelings, so I'm just going to avoid everything. So, it's no wonder that people develop some level of that agoraphobia that I was talking about beforehand, some level of, I'm just going to stay in my house. I'm just going to not ever be alone. I'm not going to go to that, I'm not going to stand, if I go to the bank and there's a really long line, forget it. I'm just not going to cash my paycheck today. I'd rather have a late fee than stand in that line. And of course, it works in the short run, which is, it's coming up. We'll go to it now. It works in the short term, so you have all these uncomfortable thoughts and feelings, emotions and memories, and you don't like that because it's really uncomfortable. So you avoid or you try and talk yourself out of it, and you feel relieved. You're like, all right, I left the bank today and I had that long line. I didn't have to stand in that line. I don't have to have a panic attack. I feel good. But then, next time you're in line, or next time out of the blue, now you even have more symptoms. Well, now what do you got to do? Well, now you got to avoid more. These are really intense symptoms. So now we got to avoid more, and now you're even more restricted in your life. Those things that meant so much to you, going to work or spending time with other people, now you can't do that because you got to avoid the uncomfortable teams. So where we say to intervene at is here. And it's a different approach. It has to do with understanding that your mind is going to be going a million miles an hour sometimes. And it's enduring some of these symptoms and allowing yourself to have them going into it. It's understanding why you're having these symptoms going into it so that you don't escape every single time that you have a panic attack. And if you can intervene at that escape, that initial escape, and kind of get through things and we'll go over coping mechanisms. I'm not just going to throw people out into the fire without having some coping skills with this. But the whole idea is that escape feeds feeds into that vicious cycle. And I bet everyone here does this on a daily basis, where we don't listen when our brain is telling us all kinds of crazy stuff, and we don't listen to it. We still do what we need to do and what we want to do. We already went over this slide real quick, and then we only got a couple more minutes and a couple more slides. The other metaphor that's often used is the Chinese finger trap metaphor. You have your Chinese finger trap. Try and pull it, you get your finger stuck. But allowing yourself, yeah, you know what, my mind machine, I always call it mind machine. My mind machine is going to tell me a bunch of stuff. And it's allowed to, because it's the thing that helps me not get hit by a car when I go out into the parking lot. It keeps me alert. But sometimes it's not helpful. And I say, thanks, mind machine, for reminding me that when I give this speech, I might possibly die. But I don't need to listen to that right now because I know I'm not going to die. Well, yeah, there's still a few more minutes left. And then the swamp, beautiful mountain metaphor. I love this metaphor. It's like if the life that you want is at the top of this mountain with this beautiful view, it's everything that you wanted. And you start down at the bottom of the mountain, and you're trudging along, everything's good, going, I met a good person, I'm going to get married, I'm going to do, whatever it is in your life that's important to you. And then, on your journey, you run into a swamp. And you're stuck in the swamp, and it's cold, and your feet are soaked, and you're like, why am I even doing this? It'd be so much easier just to turn around and go back and just stop. But if you go and do that, then you're not living the life that you want to live. So sometimes we got to go through some of those really uncomfortable moments, those uncomfortable thoughts or feelings, and the old cliche like, if it's not difficult, it's not worth it, or however you want to phrase it, that anything that's worth anything is due to a situation that's tough, or what doesn't kill you makes you stronger, any of those types of things. So again, both of these things illustrate an acceptance. I like to look at it also as a willingness to incur uncomfortable parts of your own mind and your own body in the service of what you value. So the top of your mountain is either your family or your friends or your job or whatever, or your kids, whatever is important to you. But I don't have kids, but I've heard that they can be difficult or tough at times. So, are you just going to turn the kid back in when you're going through your swamp? No. You're going to go through those rough moments. So, what I would like you all to do is to take in a deep breath, and when you exhale, allow your eyes to close. Take a couple more deep breaths, and then gently settle into your normal breathing and just rest for a moment. Now, I would like you to imagine that you're lying in a field of your choice. It could be one with grass or flowers. Just picture yourself lying there, and imagine you can see the blue sky above you. In this sky, clouds of all shapes and sizes are gently floating by. Now, I would like you to imagine that every thought you experience is magically attached to a cloud. It can rest in the cloud as a word or image, or the cloud itself can take on the image of your thought. The key here is to take each thought as it occurs and attach it to a cloud and allow it to gently float by. If you find you lose the image, that's fine. When you notice this has happened, then, without judgment, just gently bring yourself back to lying on your back, watching each cloud float by. And attach the thought that took you away to the cloud. I'm going to be quiet for a few moments and let you practice this. Just noticing each thought as it passes and placing it on or in a floating cloud. remember, if you get lost in thought and are no longer viewing your thoughts, just gently come back and continue to place them on or in a cloud. Now, I would like you to gently leave this field in which you have been running and mindfully pay attention to the transition and come back to the room. All right, well, thank you guys so much for coming.
Thank you.